Here we will discuss the interpretation of the cervical spine X-ray. In the evaluation of the trauma patient, plain radiographs may be appropriate in low-risk patients. They are easily obtained, low cost, and unstable C-spine injuries may be found in up to 80% of lateral plain films. However, CT imaging should still be obtained in high-risk patients, such as those with an unreliable exam, high-energy trauma, or neurologic deficits. There are three typical C-spine views: the lateral, anterior-posterior, and odontoid. The lateral is often the most informative, so we will spend most of our time on this view. The interpretation of this view, along with the others, can be summarized with the ABCs. First, we will look at the alignment and adequacy of the image. To ensure adequacy of the image, we should look for the lateral bodies spanning from C1 down to T1. If T1 cannot be visualized, a swimmer's view can be obtained. This view is particularly useful in visualizing the alignment of the vertebrae. There are three important lines that can be visualized: the anterior vertebral line, the posterior vertebral line, and the spinolaminar line. The cervical cord lies between the posterior vertebral line and the spinolaminar line. The line should be examined to ensure a smooth anterior curve. A disruption in these lines can be suggestive of a ligamentous injury, fracture, or subluxation of the vertebra. Here we see a disruption of the anterior and posterior vertebral lines. C5 is displaced in relation to C6. This patient had a bilateral subluxation of the cervical facet joints. Carefully examine the alignment of the odontoid process with respect to the body of C2. Here we see a disruption of the posterior vertebral line. This patient had a type 2 odontoid fracture. As you examine the anterior vertebral lines, look for bony fragments that can signify a ligamentous injury. Here at the level of C5, you can see a bony fragment of the vertebral body. A bone fragment off the inferior aspect of the vertebral body is called the teardrop sign, which is evidence of an unstable C-spine injury. Now we look at the vertebral bodies and their accompanying disc spaces. Look for loss of vertebral height signifying a compression fracture. All bodies should be approximately the same height, though note that C1 does not have a vertebral body. Also look at each corresponding spinous process and the disc spaces. The disc spaces should also be more or less the same height. A narrow disc space can suggest that extrusion of the disc into the spinal canal has occurred. Examine the cortical outlines of each vertebra. Look at the pedicles, lamina, and lateral masses. The pedicles connect the lateral masses to the vertebral bodies. The lamina connects the lateral masses to the spinous processes. Fractures through these structures can cause instability. Here we see an example of disruption of the cortical outline of C2. The cortex is disrupted where we expect to see the pedicles. This is an example of the hangman's fracture, a bilateral break of the pedicles at the level of C2. The cortical ring of C2 is a structure that represents the lateral masses. Examine the cortical ring for irregularities or breaks. Irregularities of the cortical ring are indicative of an odontoid fracture. Irregularities of the predental space can also be seen in the lateral view. This space spans the distance between the anterior odontoid and the anterior aspect of the ring of C1. Increased distance here signifies disruption of the transverse ligament that holds the odontoid process against C1. This may accompany instability at the level of C1, such as in atlantoaxial dislocation or in a Jefferson fracture. The space should not exceed 3 millimeters in adults or 5 millimeters in children. Lastly, in the lateral view, we look at the soft tissue and surrounding structures. The prevertebral space represents the soft tissue anterior to the vertebral bodies. It is narrow above the level of C4 and widens as it descends. Widening of this space could indicate a hematoma from a fracture not visible on the image. Different cutoffs can be used for the normal range, but one mnemonic is the 6 and 2 rule. In adults, the space should be less than 6 millimeters at the level of C2 and less than 22 at the level of C6. In pediatric patients, the space should be 1/2 to 2/3 the width of the vertebral body. And of course, don't forget to look at the surrounding structures, including the base of the skull and the mandible. C-spine injuries are not as easily seen on the AP view as in the lateral, but can provide additional information. The approach is similar to the lateral. Again, we will use the ABCs. In examining the adequacy of the images, C1 and C2 may be poorly seen in this view. However, ensure the remaining vertebrae are visible. Look for the alignment of the lateral edges of the vertebra as well as the spinous processes. The lateral edges of the C-spine should form continuous lines. Again, we look for even spacing of the vertebral bodies and disc spaces and relative similarity in size. Again, trace the cortical outlines of each vertebra, though fractures are not as easily seen in this view. And lastly, look at the soft tissues and surrounding structures. Notably, the ribs and clavicles can be seen, as well as the lung apices. Finally, we have the odontoid view, which is particularly useful in the evaluation of the alignment of the lateral masses and the odontoid. Again, we return to the ABCs. For adequacy, ensure that C1 and C2 are adequately visualized. Highlighted in red, we have the lateral masses of C1, which sit above the articular surfaces of C2. In pink, the odontoid process is outlined. When looking for alignment, we look at both the lateral masses and the odontoid peg. The space between the lateral masses and odontoid peg should be equal, implying a non-rotated image. The lateral edges of C1 and C2 lateral masses should align. Here we see displacement of the lateral masses of C1 with respect to C2. This image depicts a Jefferson burst fracture of C1. Again, the body should be examined and cortical outlines traced. Here we see a fracture of the odontoid process. And again, don't forget to look at the surrounding structures. To review, the interpretation of the 3 C-spine X-rays can be summarized with the ABCs. Check for adequacy of the images and alignment of the structures. Look at the bodies, disc spaces, and cortices for disruptions, irregularities, or asymmetries. And lastly, don't forget to look at the soft tissues and surrounding structures. Here are my references, and thanks for joining us for this review of C-spine X-rays.